opioid-related issue in 2014, where 2,000 Massachusetts residents died from an opioid overdose just last year. 69% of those cases had the illicit opioid fentanyl in their bodies. 69% of those who died had fentanyl in their systems. If people across the country were dying from overdoses at the same rate as in Massachusetts, that would be 100,000 people per year. 2 Vietnam Wars worth of deaths every single year. Over 10 years, that would be 1 million people who died if they were dying at the same rate as they are in Massachusetts. 1 million people over 10 years dying from opioid overdoses in our country. If these Republicans took their heads out of the sand, they would hear the near unanimous calls from the experts and the pleas of mothers and fathers to stop this machete to Medicaid, which they have brought with their new health care reform bill. They would hear the alarm bells Americans across the country are ringing against this cruel and heartless and immoral legislation. These desperate voices should be enough to get Republicans to abandon their efforts to rip away insurance coverage for treatment and recovery services for Americans struggling with substance use disorders. But instead of accepting the truth and listening to their constituents, they've decided to take a cynical path and replace these life-saving services with a paltry opioid fund of $45 billion over 10 years. Now, there's been a lot of talk from the Republicans about so-called fixes that they can work on with Democrats. But this opioid fund isn't a fix. It is a falsehood. It's a false promise to the people suffering from opioid addiction. It's a false future that won't include critical Medicaid funding for treatment and recovery services. It's a false bargain that Republicans will make at the expense of families desperate for opioid addiction treatment. This opioid fund is a politically craven effort to buy votes from Republicans whose states are being ravaged by the prescription drug, heroin, and fentanyl crisis. But the American people will not be fooled. This opioid funding is nothing more than a public health pittance, a wholly inadequate response to our nation's preeminent health care crisis. In fact, the amount included in this latest version of Trumpcare is not even half of the amount that the Affordable Care Act would have spent on covering opioid use disorder treatment if we just left that law alone to work as intended. Here are the numbers. The Center for American Progress has estimated that the Affordable Care Act would spend $91 billion for opioid coverage alone over the next decade, compared to the $45 billion which the Republicans are putting into their bill, which they announced today. We already know that access to treatment is a challenge. Only 1 in 10 Americans with substance addiction receive treatment. Only 1 in 10. There are estimated to be 2 million people with an opioid use disorder who are not receiving any treatment for this disorder. It should not be a surprise to anyone that the epidemic of opioid abuse will only get worse as long as we have a system that makes it easier to abuse drugs than to get help for addiction disorders. And the paltry GOP fund that provides less than half of the funding of the Affordable Care Act is only going to accelerate the death sentence for the millions of people with substance use disorders. And sadly, we know that my Republican colleagues attempting to jam this immoral and callous Trumpcare bill through this body actually are aware of the crisis facing their states. They speak to the same constituents. They read the same newspapers. They see the same obituaries of Americans who lost their lives to the opioid overdose epidemic. And that's why we've been able to make some bipartisan progress. Last year, we passed the CARA bill. We passed legislation to fund $1 billion in treatment. But support for the Trumpcare bill and this opioid fund is a betrayal of all of that hard-fought progress that we were making. Republicans are turning their backs on their vow to combat the opioid epidemic. And President Trump is breaking his promise from the campaign trail to, quote, expand treatment for those who have become so badly addicted. Instead, they are moving forward with a proposal that would rip insurance away from 22 million people and threaten insurance coverage for 2.8 million Americans with a substance use disorder. This bill would eviscerate Medicaid, the leading payer of behavioral health services, including substance use treatment, by nearly $800 billion. And all of this to give billions in tax breaks to billionaires and big corporations. One analysis has found that under the Senate's previous version of Trumpcare, Republicans provided a nearly $33 billion tax break to the top 400 earners, the top 400 billionaires in America, which is the equivalent of ending Medicaid expansion for too many people in our country. Let's just look at what they're planning. They're planning to cut from $91 billion down to $45 billion, the amount of money we spend on opioid treatment in the United States. Now, at the same time, they've got $33 billion that they're going to give in a tax break to the wealthiest 400 billionaires in America. Where is that money going to be better spent in our country over the next 10 years? $33 billion for the 400 wealthiest people, or adding that money back in so that we can have the treatment for people who have opioid addiction problems in their families? What's going to be better for America? Well, the Republicans say we need all that money that would go for treatment to give it to the wealthiest people in our country. They can afford for their treatment. Their family will have all the health care coverage that they need if they have problems in their family. But the Republicans don't care. If you kick them in the heart, if you kick this bill in its heart, you'd break its toe. You'd break your toe. That's how bad it is. So for me, this is, without question, at the heart, a simple explanation of what's fundamentally wrong with this Republican bill. There are many other things wrong with it. Pre-existing conditions, go all the way down the line. But how can you, when we have this modern-day plague, which is hitting our country, take all that money away and give it away to billionaires? It's just wrong. Too many families, too many letters, too many conversations that we've all had with these families, too many tears that we've seen. And so for me, there can be nothing that is worse than doing that to families, taking away their hope. And this is going to be a battle of monumental proportions. And all I can tell you is, for the 2,000 families that died, that had someone who died in Massachusetts last year, we're going to make sure this is a battle that everyone knows. Because if they understood, if the American people understood that they're doing this to all of those families that have an opioid problem right now, there would be a revolt that would rise up across this country. And over this next week, the American people are going to learn about what's in the soul of this bill. So, Mr. President, I yield back to balance my time.
Mr. President.
The senator from Tennessee.
Mr. President, I'm here with Senator Corker today to address the Senate and encourage this body to vote to support Bill Hagerty as our ambassador to Japan. In 2013, when Bill Hagerty was the Commissioner of Economic and Community Development for Tennessee, he gave a speech entirely in Japanese at the American Embassy in Tokyo. Now, I've looked it up. There have been 16 United States ambassadors to Tokyo, a very distinguished group since World War II. a five-star general, 2 former Senate majority leaders, a former Vice President of the United States, former Speaker of the United States House of Representatives, the daughter of a former President of the United States, and so far as I know, none of them were able to do what Bill Hagerty did in 2013 when he made a speech entirely in Japanese at the American Embassy in Tokyo. That's just one reason I think that Bill Hagerty is one of President Trump's best appointees. He was born in Tennessee, graduated from Vanderbilt University, was associate editor of the Law Review, worked as consultant for the Boston Consulting Group. During his final 3 years, he lived in Tokyo and he served as senior managing executive for their clients around Asia. He was selected by President George H.W. Bush to be on his staff, and there he worked on trade and commerce and defense and telecommunications issues. He was a White House fellow. He was founder and chairman of a company in private life that became the 3rd largest medical research company. He founded his own private equity and investment firm. From 2011 to 15, he was the Commissioner of Economic and Community Development for Tennessee. And in that role, working with Governor Haslam, was enormously successful. They secured $15 billion in investments and 90,000 jobs for our state. In 2 of those years, Tennessee was the #1